We're starting the show as we begin with childbirth. So when you find out you're pregnant, getting the right care quickly is a top priority. And while OBGYNs are one option, many women choose a midwife instead. And here to talk about the differences in care and maybe bust some misconceptions is Mary Mattel, a nurse midwife from Swedish with more than 20 years experience. Oh my gosh. Thank you for being here.
I'm glad to talk with you today.
So let's jump into these misconceptions I hear from people from time to time. What is a midwife?
Yeah, so at Swedish, all of the midwives are nurses with a master's degree in midwifery who have passed a national certification exam.
Wow.
So we are most known for our pregnancy care, and midwives are experts in low risk, low intervention pregnancies. But we also provide well woman care across the lifespan, so we could take care of you for your first pap smear, give you advice about birth control, or talk to you about menopause when the time comes.
So this isn't just for birth and babies.
No.
You got us from when it starts to all happen to when it's starting to slow down. I think this is so fascinating. What do you do, though, that's different than an OBGYN?
Yeah, so midwives and obstetricians have related expertises, but they're really different fields. So obstetricians are physicians, they're surgeons, they have special training in complication, high-risk pregnancies. If someone needs a cesarean, they're the ones to do it. Midwives, our expertise is in low and moderate risk pregnancies, and we have a lot of what I say is curiosity and interest about how rich that experience is for families, even when everything is going normally. Sometimes you'll hear people describe a pregnancy as uneventful, and they mean that there's no complications.
Right.
But a midwife would never say that, because we know for families, it's always eventful.
Huge. It's very eventful.
Yeah, so we have longer visits and we spend more time doing education and talking to people about their emotional experience.
Which is so important. And then this is where one more question about this.
Yeah.
Then what is the difference between a midwife and a doula?
Yeah, that's another great question. Midwives and doulas also have a lot of shared skills. They both provide labor support, information, encouragement. And Swedish actually has an in-house doula program because we know the research about their benefits is so strong. But midwives take the additional step of being your healthcare provider. So we're the ones ordering the tests and interpreting the results and writing the prescriptions, and then we have our hands there when you're giving birth and delivering the baby.
So I have to imagine when you're talking about the difference, but sometimes you do have to work with these surgeons. So what happens and how do you balance and the difference between the process of the natural processes that the body goes through to medical interventions?
Yes. So midwives, we're experts in the normal physiologic process of pregnancy and birth. We're also trained to always be monitoring for potential complications and emergencies. At Swedish, we have a really close working relationship with the obstetricians, and so when something unexpected or emergent happens, the obstetricians are just as available for the midwifery patients as they are for their own, and there's no delay in care. Women get the care that they need.
Yeah, I love that. I have a question about the setting. And is a midwife only in the home, or can you have a midwife in a hospital just in case you're nervous and you want to be near that medical care?
Yeah, I think that's a common misconception that midwives are associated with home birth. And I say that as somebody who had 2 babies at home myself.
Oh, you did?
I think that's a great option for low-risk women. But at Swedish, all of the midwives who attend births are doing so either at our First Hill or Issaquah Hospital. And in fact, the majority of certified nurse midwives attend births in hospitals.
Okay, that's good to know.
Yeah.
So you mentioned uneventful pregnancies, but what if someone is a bit higher risk? Can they still have a midwife?
Yeah, that's a great question. We are trained to monitor for the complications that can sometimes happen when somebody's higher risk because of age or a pre-existing health condition. And we consult as needed when things come up. So we do take care of women who I describe as moderate risk. So sometimes people have a sense that maybe they can't come see a midwife, but the majority of women would benefit from midwifery care, and so we really try to make that accessible to them.
I think that's great because I feel like over the years, the context of the midwifery care that you mentioned isn't as archaic as people think, how is it now blended into the modern medical system?
Yeah, so there's a whole body of research that shows that the more integrated midwives are into the healthcare system, the better outcomes are. So not only are we kind of frontline for caring for women in their pregnancies, but you'll see midwives in obstetricians' offices, in perinatologists, the highest risk pregnancy office. They're assistants in gynecologic service. They provide lactation support. So midwives really have a lot of skills and show up in a lot of different departments and serve families in a lot of different ways.
Oh, you mentioned lactation, so that makes sense. So even after the baby is born, you're stepping in and helping everything work. Because sometimes that is the hard, for me, it was so hard.
I know.
So having that support, you do that.
We do. I think sometimes in our healthcare system, we're like, oh, you had a baby. See you later. Surely nothing is going to happen in these next couple weeks, when really that's the richest time, and midwives try to be there to provide ongoing support.
Okay, that is amazing. I wish I'd known about this, and I wish I'd had you by my side when I went through it, because it really is scary.
It's a really complex experience. Even when things are going normally, there's lots of challenges, and it stirs up lots of emotions, and midwives really want to talk about that whole process.
I am so grateful you exist. Thank you so much for your time and sharing this and explaining to us all these wonderful things that you do.
Oh, thanks for your questions. It was nice talking with you.
Absolutely. All right. So to learn more about labor and delivery at Providence Swedish, including using a midwife, visit the website on your screen.
Special presentation of New Day Northwest, sponsored by Providence Swedish.